Well, thank you all so much for joining us this morning, bright and early, for our third State of Affairs event. We are really excited to present some of our research today, looking at how we can change work design to improve mental health in the healthcare and social assistance industry. Before we get started, we want to just acknowledge country. I would like to acknowledge the land that we're on today and acknowledge the deep and ongoing history and culture of this land. So I would like to pay my respects to the Gadigal people of the Eora Nation, the traditional owners of the land on which we meet. I acknowledge the elders past and present for their spiritual connection and continuing traditions. So our agenda. Firstly, we will have a welcome from the Honourable Sophie Cotsis, who will open our event today. Then we'll share some of our research journey to date, showcase some of our latest redesign insights, and have a panel discussion and Q&A with some of the participants of our research, which is really exciting. And then we'll close with our Q&A. Some background on our project. We are very generously funded by iCare, and our project is led by Professor Sharon Parker at Curtin University. So Design for Care is a research project that's funded by iCare, as I said, with the goal of developing and evaluating how work can be redesigned to promote mentally healthy workplaces in the healthcare and social assistance industry. We are led by Professor Sharon Parker, who is the leader of the Centre for Transformative Work Design at the Future of Work Institute at Curtin University, with Professors Anya Johnson and Helena Nguyen at the University of Sydney, who we'll hear from today, as well as Professor Alex Colley at Monash University. So before we go any further into the session today, we will hear from the Honourable Sophie Cotsis, who is the Minister for Industrial Relations and Work, Health and Safety. Sophie is the Member for Parliament for Canterbury, where she was born and attended school before completing her undergraduate and postgraduate studies at Macquarie and UTS. Sophie was elected in 2010, and as part of the Shadow Cabinet, she had a strong interest in healthcare and social assistance industry, playing a key role into the inquiry into elder abuse, as well as supporting organisations that can care for vulnerable people in the community. Sophie's work in industrial relations and work health and safety, as well as her previous role in mental health and ageing, give her great insights into the challenges and opportunities in this industry and the importance of creating a sustainable workforce. So please welcome Sophie.
Thank you very much, and thank you for having me here this morning. I too would like to acknowledge the traditional owners of the land and pay my respects to elders past, present and emerging. I'm delighted to show my ongoing support for the Design for Care initiative and to hear more about the progress from the Smart Design for Care team from Curtin and Sydney universities. Of course, I'd like to acknowledge the frontline workers and leaders from the various healthcare and social assistance organisations and unions who are here present today. As the Minister responsible for Work, Health and Safety, and I am the first Minister for Work, Health and Safety for over a decade, and the Premier ensured that there is a dedicated minister to look after this area because it's an important area for the government, but the work that you're doing exists because of the priority that we have as a government. And I'll have a bit more to say at the end of my presentation around the government's whole of government return to work strategy. As I said, the government is committed to finding evidence-based preventative solutions to health and safety issues for working people in the state. I am a big supporter of this very important initiative that's funded by iCare. iCare is an organisation that I'm also responsible for as the Portfolio Minister. And I'd like to acknowledge in particular the project lead, Professor Sharon Parker from Curtin University, along with Professor Anya Johnson and Professor Helena Nguyen from the University of Sydney and Professor Alex Colley at Monash University. As many of you would know, the most recent census in 2021 revealed that over 4 million Australians reported having a mental health disorder in the past year. Additionally, according to the ABS, around 1 in 5 people in our workforce are dealing with illnesses like anxiety and depression. And these figures are very alarming, and particularly for us in the government. You would have seen a report in the Sydney Morning Herald today reporting on the Audit Office report about workers' compensation and the high number of workers' compensation claims in our law enforcement, in police, health and education. So it is alarming, and it is more alarming post-COVID. And these figures send a very clear message that mental health is now the number one workplace challenge of the 2020s. And I'll give you just a quick anecdote. A few weeks ago, I was presenting to a group of delegates from the manufacturing industry, from steel, manufacturing, very blokey, and I was presented with a number of questions. And not that I was actually I was shocked, to be honest with you, the questions that I was asked. And I thought it would be, a range of things around work health and safety in their area. And I had consecutive questions about mental health in the workplace. And I was shocked because I didn't expect those type of questions. And so, as we know, this is a number one issue, and it's raised with me constantly, particularly in the private sector as well. Small businesses raise with me, and for them, as a small business, they're concerned because they don't have capacity or resources. And that's why I think this project is very, very important. As I mentioned, we're witnessing a rise in psychological workers' compensation claims worldwide, and the pressure on workers and employers is intensifying. The most concerning part is that our workers in healthcare, aged care and disability care industries are disproportionately affected. The healthcare and social assistance sector is the largest industry in New South Wales, and in 2022 there were over 17,500 claims within the sector. To date, these claims have cost over $203 million, with an estimated future total cost of over $370 million. The Design for Care research shows that over the 9 years to 2021, the New South Wales healthcare and social assistance industry lost more than 170,000 working hours due to psychological injury. Now, this is a significant issue that needs to be addressed, and our government is committed to finding solutions. That's why we're supporting this project wholeheartedly. I'm here to provide you, to also demonstrate that support. And in contrast to other jurisdictions, we want to continue to lead the way in managing psychosocial hazards in the workplace. We know that applying effective work design approaches means employers are far more likely to comply with their work and help with their work health and safety duties and address psychosocial risks that many contribute to poor mental health and wellbeing, like burnout on frontline workers who give so much care for the community. Design for Care research has shown that poor work design is a common factor behind rising workplace stress and burnout among healthcare and aged care workers. These essential workers have supported our communities throughout Australia during COVID, and now they deserve our support. So to our knowledge, and I'll say that this is the first of its kind research into the effectiveness of work redesign interventions to address psychosocial risks in the healthcare and social assistance industry, and we are excited to hear of the progress from the 30 work redesign interventions implemented in 5 pilot organisations over the past 2 years. On behalf of the government, I would like to thank the Smart Design for Care team and the industry organisations who are leading the way by trialling smart work design and undertaking a fantastic collaboration, and to iCare for their funding, their ongoing funding. And I also wanted to report to all of you that when I first came in, and this was one of the first forums that I attended, and it has been a very intense and very a fantastic year, but I have learnt so much from all of you, and we're about practical solutions. And one of the things coming into government, having the responsibility of iCare and safe work, and for the first time being able to have a minister that's dedicated in this area, being able to have the 2 organisations collaborate and work with you all, that was the first first very important step. But one of the other things that we're doing as a government is we've established a whole of government return to work strategy. And I took a proposal to the Cabinet and it got through. We will have a draft strategy in coming weeks, and it's about having iCare, CIRA, the Public Sector Commissioner and a number of other central government agencies and Treasury, importantly, working together and working through what is the best way in assisting, particularly as government, how we can support people, case manage them, and to return to work. I'll give you a quick example. We will have every day we've got around 1,100 to 1,200 public servants who have capacity to work, and for a bunch of sticking reasons they're unable to, and these are the blockages that we're trying to unblock. And if I've got a cleaner from Canterbury Hospital who's been injured at work, and not necessarily physical, psychological claim, can't go back to that workplace, we're unable to provide support for this cleaner to go and work at Bankstown Hospital. That's how restrictive, that's how they're the blockages, and we need to remove those. This is what we're doing, and we'll have a draft strategy coming out soon, and I will come to you to seek assistance as well, because I think having a lens of your smart work design is going to be very, very critical to us. It means people get back to work. It means we as a government provide that one-on-one case management to the workforce, and we're not losing the skills. And more importantly for the workers, it means that they're coming back into the workforce, and it helps them and their families. So this is a really, really important project. I thank you all for participating, and good luck with today's deliberations. Thank you.
Next up, we've got a keynote presentation from two of the professors working on our project, Professor Anya Johnson and Professor Helena Nguyen from the University of Sydney, who are both professors at the business school at USyd. They work closely on the project and have worked together for the last 20 years, investigating how work can be designed to improve and assist in mental health and wellbeing. So I'll pass it over to Helena and Anya.
I feel like we're coming on as a double act, but anyway.
Dynamic duo, Anya. Good morning, everyone. It's wonderful to see you all here bright and early. I must admit, and I think I was mentioning this to iCare, like last night I had a bit of anxiety, sort of the feeling you get before you have a big party and you think no one's going to come. But you're all here, so good. But I might start with a bit of a recap and just to add a bit more to the Minister's address and some notes about the major challenge that we're trying to address in this project. So as the Minister noted, we know that mental health and wellbeing are significant issues in the sector. So from our own research, and this is the research that we presented at the last State of Affairs, that psychological injury claims in the healthcare and social assistance sector have more than tripled over the last decade and have continued to grow more than any other industry exponentially. And I think some of the stats that the Minister quoted is really compelling. Further analysis, and this is what we had presented in the last State of Affairs, but this really just highlights the extent of the challenges, is we analysed more than 1,300 care workers, and we found that work design is a key driver of mental health and wellbeing issues. Overall, in that data set of 1,300, we found that 1 in 5 workers reported feeling burnt out. When we asked about the quality of their work, but this is about solutions, practical solutions, which is the focus, we know the problem is well established. When we asked about the quality of their work, only 15% reported having good work design. When we drilled further down, we found that stats from 1 to 5 reduced down to 1 in 10 only for those that reported good work design and deteriorated to 1 in 2 if they reported bad work design. And that just illustrates some of the relationships. This is some very recent data and this is at the team level. Again, there is not a lot of data around this and not a lot of evidence in the H&SA sector, but this is team level data. It's taken from a large disability care service with over 50 teams. And as you can see, just from the scatter plots, there is a clear positive correlation between good work design or work design and positive mental health outcomes such as thriving on the left-hand side, and a really clear negative correlation between work design and poor mental health outcomes such as burnout. So this is really exciting because it's at the team level and we're finding very similar results. So what do we mean by work design? So we sort of jumped into this, but let's just appreciating that some of you this might be your first state of affairs. In the Design for Care project, we use the SMART, and you can see we're all in gear today, the SMART Work Design Framework, which is quite comprehensive, and you can see up here, there's a lot of factors that contribute to good work design, and what we know more generally as the psychosocial risk factors, which are factors that contribute to poor work design. But in brief, good work design is SMART design, and it is work in brief that is stimulating, so it gives people opportunities to use skills and to learn new skills. It gives opportunities to gain mastery. This is about competence. There's clarity, there's feedback. It gives people agency, also known as autonomy or control, that it's relationally rich, which means that there's a lot of social capital in that organisation as well as in the job, and that there is enough resources, and these are the SMAR, all resources, whereby people can cope with the demand. So it's at least tolerable. So the model acknowledges we can't get rid of all demands, but the demand needs to be able to be tolerable, because we know stress is a factor when there is less resources to cope, when it exceeds the resources that people have available. So I'll just make a move a bit here because we've got a lot, and you can see these chairs here where we're going to have our participants chat more about their experience. So how do we get to smart work design? Again, going to practical solutions. So in this project, we support organisations to create better work for employees and workers in the H&SA sector by employing what is known as the PARRTH to Smart Work Design, which is an evidence-based organisational change framework, whereby you can see we sort of co-create and collaborate closely with organisations as part of a participatory co-design process, and that's fundamental to the PARRTH process. It is about walking alongside, really taking on the perspective Okay, so who are our partners? So currently we're partnering with 7 organisations, and in the redesign phase, and so far we have taken 4 organisations through the redesign phase, we collated over 100 redesign intervention ideas. This word cloud here just presents you a summation of the dominant themes that came out. And those themes were there were interventions that related to things like wanting more opportunities for better communication across the organisation, opportunities for closer connection between colleagues, a strong appetite for feedback and for training, and interventions that speak to the value and the importance of the managerial role to create good work design. They were the key themes. From the 100 or so, we then worked with each organisation. As I mentioned, there's 4 that we've worked with so far. The 3 are in train. We were able to drill down to 30 based on timelines, feasibility, resourcing capacity. And so to date, I think as the Minister noted, we have implemented 30 work redesign interventions. And today, as I mentioned, you'll be able to hear from the people who have gone through the experience. So I'll hand over to Anya to give you a deeper dive on 3 examples.
Thank you, Helena. So this is an opportunity really to share with you 3 specific examples of work design, and then to hear from people who've been involved in that process. So the first is what we like to call our guinea pig partner, Key Assets, who is an out-of-home care organisation. And this one was a team of social workers who were out at Blacktown. And the challenge that they identified was the emotional demands that they all experienced at work. And I don't think it takes more than a few minutes for us to put ourselves in the shoes of a social worker in this industry to understand the kind of emotional demands that they're experiencing. And they wanted to redesign and think about their work in terms of social support and how they can improve the social support within their organisation. So the team chose to focus around, firstly, how they have regular check-ins, both between themselves and with their manager, and how they build out their capacity for managing their own emotions and managing and supporting each other's emotions. So that was a very big focus for this team, and it's been something that they've put a lot of effort into and we'll hear more about. So what has been the outcome? So what we found, and this is showing some data that we collected from Blacktown after the intervention had been in place for quite a few months. And what we found was that they actually reported having higher levels of or higher opportunities for development. So they found that, in fact, their work was more stimulating. They reported having more feedback from their manager, which relates to their sense of mastery in their role. They felt more supported by leaders as part of this sort of opportunity. They reported their emotional demands as more tolerable. I do want you to note, though, they're still very low. It's still a big issue, but it was more tolerable, and actually reported higher or better work-family conflict. So that was going a little better for them as well. So some interesting changes just in terms of how they reported and saw their own work design. But really critically, what we also were interested in is what would be the impact on their mental health. And what we found was that we had much lower scores around burnout, particularly feeling disengaged with work and finding it difficult to engage, but also less exhaustion, emotional exhaustion, and lower intention to leave. So all the indicators of poor mental health had gone down, and then again, very pleasingly, thriving at work, feeling like you're learning, feeling that you have vitality, and overall well-being improved. So a really nice example of when we were able to both assess what the situation was, work with the team, and really they decided on what they wanted to give a go at. They got a lot of leader support to do it, and then they've worked really hard at it. And when we came back 2 years later to have a look at how they were tracking, we found these substantial changes. The second case study I wanted to highlight was one where we partnered with Nguyen, and particularly Grafton Residential Aged Care, so a regional residential aged care. So in this particular case, it was around trying to improve mastery, or trying to improve that sense of competence and confidence during the onboarding process for new assistants in nursing. So this was during a particularly challenging time, I'm sure it's still challenging, around staff shortages and bringing in new, young, often, not always, but new advanced assistants in nursing who really didn't have very much experience and didn't have a great deal of training. And traditionally, the way that this worked is that the AIN would start, they would have 4 what are called buddy shifts, and they would spend the time shadowing a more experienced AIN who would show them the ropes, but doing this on top of the work that they normally do. So working with residents and just, this is how we do this is how we, that kind of thing. When we talked to the AINs at the site, one of the things they really felt quite passionately about was that they could do this much better. They could build the confidence of the new AINs coming in. They also felt that they weren't doing a good job themselves in training and developing and supporting the new AINs. And so it was a real opportunity to make a change. And they proposed that they would have one of the 4 days when, instead of just having a shadow, they would actually make it their job to work with the AIN and really make sure that they understood what was happening, connected them to colleagues, and made sure that they were sort of understanding and really learning from other people at work. And I have to have a shout out to Nguyen, because this is not financially neutral. When you have someone additional who's going to come in and take on a role, that does require support, providing someone else in that role at the same time. So a big shout out that it's not just a change in the way that they work, but also a financial cost that they were willing to trial. So what did we find out? We are at the moment collecting survey data from Nguyen, so I can't yet present that. But what we can present is some interviews that we did about 2 months after we started this particular intervention. And what we can see from the experienced AIN is, and the bit that I love is, you don't go home feeling like the new AIN are going to drown. So that real sense that I'm actually doing something to support someone else to learn, and that will make a longer term difference. And then for the new AIN, being able to take in the information, learning from different people, having experiencing different things, I think it made my experience much easier. So again, just anecdotally, based on these interviews, we know that there's an impact, and we're really hoping to see that through our data in the track survey. And then finally, we had a intervention with Bankstown City Aged Care, so a metropolitan aged care, residential aged care facility. And the challenge that Bankstown were experiencing, and particularly Yalambee Village, was around how the day started. And so something that they identified was that when carers come for the morning shift, the registered nurse, who normally does the handovers, may or may not be available in the moment that they arrive. And so that RN may be with a resident, may be dealing with another issue, maybe having a challenge somewhere else. So people were waiting to get the handover, waiting to hear what were the critical tasks, how work was going to be distributed. So as a group, they came up with the idea of having a couple of different whiteboards that they would keep in staff areas where key tasks and critical issues could be written up, and where they would all have visibility of what was happening. And so when they arrived in the morning, they could go in, check the board, see what was happening, and then start their rounds, and then come back in, check on the board, check with the RN. But this became a much more flexible, more agile way of working, and it enabled them to actually have much better, so one of the things they reported to us was much better relationships with each other, because they didn't feel that they were waiting, they didn't feel that they were wondering what was happening. So what was the outcome? Again, this is they're in the process of doing their track survey, so we'll be reporting those findings later. But based on the interviews that we've done, again, the one that I particularly love, it makes it easier for us. Instead of having to chase the RN, we're responsible now. We just look at the board and then we know what we're doing. So, as Helena said, we started with over 100 ideas. We've really worked at trying to bring into sort of practical realisation 30 of those. And we've got 3 slightly deeper dives here. So we do have this written up in a report along with some other insights, and you all have something on your table which will allow you to access the report, which is on the website. So we really encourage you to read that. And we might go to the next part of the presentation.
As Helena and Anya said, we've got a panel of our participants who've joined us today. Some have come quite a long way to be here, and they're going to share their experiences with us. So I'd like to welcome to the panel Imran, Ayubi, who is a team leader at Key Assets New South Wales. And so Imran was involved in the intervention, the first intervention that Anya spoke about, which was finding opportunities to create shared rituals to prioritise self-care amongst social workers and upskill staff on emotional intelligence skills. Next up, we've got Canada Long, who is an assistant in nursing at Whitten. And Whitten, as Anya mentioned, was really focused on improving the onboarding experiences for new assistants in nursing using the supernumerary shifts to provide training and guidance to new staff. Then we've got Sala Singh, who is a facility manager at Bankstown City Aged Care, and Werda Kabukos, who is a care service employee at Bankstown City Aged Care. And their intervention was really focused on how to implement the new whiteboards so that handovers could be a bit more seamless and effective. So I'm going to take a seat with the panel and we'll ask some questions. Don't forget, we've also got the QR codes on your tables if there are any questions that come up for you while they're talking. Okay, so to start with, maybe we'll start right down the end. Imran, can you tell us a little bit more about the intervention and how you were involved and what did you do?
Absolutely. Good morning, everyone. Our intervention was working towards emotional intelligence for the staff. We are an out-of-home care agency in New South Wales. So our interventions were weekly wellbeing Wednesdays, where we provided a safe space for the team just to check in, talk about their day, what's going on for them. So we are, as a team, accountable for how everyone else is feeling as well. We had, following our meeting with the Design for Care team, we also established a training from one of our internal therapists who provided information on how external stimuli can affect our internal body, our mind, and how the brain is connected to our body. And another thing that we ran was emotional intelligence training, which myself and another social worker developed and run with the team. And we also held weekly leadership training as well and get-togethers.
So lots of opportunity for connection and to learn and for growth, I think, there. Maybe Canada, can you tell us a little bit more about the supernumerary shifts and what it was like before the shifts started and how you guys changed?
Good morning. Thank you all for being here and listening to us ramble. So before we introduced the supernumerary position, we would have a buddy. You'd have to complete your normal work while trying to teach them how we do things, why we do it, why it's important. And you're also trying to juggle that with your relationship with the client while you're with them as well. You want to give them the attention that they need and that we want to give them. It is a big part of their social day when we spend half an hour with them, so it's a very limited time. We introduced the supernumerary position to try and alleviate the stress from both the experienced staff and the new staff coming in. We wanted to really try and engage them and let them do things, get them to understand why we do it the way we do it and the choices we make and why we need to make them. It was very rough trying to do that while balancing our normal jobs, and accomplishing everything in one day was a big task. So the supernumerary position enabled us to take a step back, and we weren't worried about the goings-on of the entire day. We were able to take our time and let them experience things for themselves. So thank you. And it's been really great.
Perfect. And Bankstown City Aged Care, what did you guys do and what was it like coming to work in the morning before and then after?
Good morning.
Good morning.
Hello.
So now it's like so much easier for us because like instead of waiting around, we just come to the board, look what's the task for the days, and then it's just good for the time management as well. It get us spend more time with the clients instead of just wasting our time waiting around. Yeah, that's it.
Yeah, so we basically had staff members from each shift, from night duty, morning shift, and afternoon shift. And they met up with Smart Team with 2 meetings and talked about what frustrates them at work, what are the barriers at work, what is causing them stress and burnout. And they came up with 3 main theme of events. And we narrowed it down to see what was more priority. And we picked up that handover process was really, their find was wasting their time. And for various reasons, they are delayed. Sometimes the oncoming shift staff are late, or sometimes the people that are on the shift at the time have incidents and they're forever waiting. And when they go to the clients and the clients are upset, they're not understanding that why they are late. Sometimes they're 10, 15 minutes late because things happen. And then we worked. Then management were invited. So we went and we listened to what have been brought up by the entire team of people. I think there were about 10, 15 people from various shifts. But the themes were the same. Handover process really came out to be the contender. And then we discussed about what we could do to streamline it or make it better for everyone. And we found a solution. We thought we'll trial it. So we have 4 major areas. We have, in a private room, we have a whiteboard. Then we met up with the team internally and said what really needs to, what do we, with the RNs as well, what really they need to communicate on every shift, which was the incidents that's happened, anyone that has appointments, and any special things that they wanted to communicate. So every shift at their own leisure updated the board, and oncoming shift come and check, and they don't have to wait around for people for handover and things like that. So it's working very well, I think.
Yes, it does.
And what are the factors you think that contributed to the work redesign intervention being successful? Was there maybe 1 or 2 factors that you can identify that really helped it be a success?
It's a bit like support from the management team as well. And it's like everyone on the same board as well. Yeah.
And I think it needs a bit of time for culture to set in. We kept reinforcing, and on morning shift, basically we found some people still waited for the RN to give handover. And we sort of keep reinforcing that, no, there's no handover now. We checked the board. Afternoon shift, I found that they were coming on the shift, while morning shift want to get off the floor and do documentation and things, they are still sitting around waiting for a handover. So there was a little bit of culture change, and we kept reinforcing that there's no handover. We go to the handover board and making sure everyone does that and making them more responsible, actually, of going to the board instead of RN giving handover.
So that kind of shared commitment and the leadership reinforcing.
Yeah.
Canada, did you have anything else that contributed?
Our biggest contributing factor was the support from management and head office. Obviously, as Anya pointed out, it was a financial issue. The other issue being that sometimes we just don't always have the staff to take somebody off the floor to do and fill the supernumerary position. But we have worked towards it, and the staff, especially on the floor, are very understanding of what we're trying to accomplish, and they're also very well aware that we need to try and give these people some more breathing room and give them more time to accomplish their tasks for the day.
I think that leads us into the next question nicely. Were there any barriers to successful implementation? Imran, maybe we'll start with you.
I think a few of the barriers that we faced was turnover of staff. So over the 2 years, we had a few staff members leave when we run the training. Another barrier was time and conflicting schedules of the social workers' calendars and being available to attend some of the weekly check-ins and some of the regular meetings as well. So that was the barrier that we faced in our Design for Care project.
Did you guys do anything specifically to overcome those barriers?
We try to target different times of the day, so at least different people, different social workers were available for some sort of check-in, and we're trialling out now to change some of the days when we're all in the office, so everyone has that time to communicate about how they're feeling towards each other as well.
And were there any barriers for you guys?
The only barrier is when we have like external, as in agency RN, on the shift on the night before. So like it's either they don't know the procedure or they just don't have the time. Yeah, just about it.
Yeah, so it sounds kind of that having consistency of staff and everyone being available and able to be involved is really important, and also to make sure that everyone's involved in the process. The biggest lesson that you guys have learned from your involvement in Design for Care Canada, what have you taken away from your involvement?
I think the biggest thing that I can acknowledge at the moment is the time and effort that we put into training and how important that really is.
And Werda?
Oh, that was like we able to speak up our mind, like what we're not able to say back at work in that during the during the work design, we're able to speak up our mind kind of thing as well. Oh yeah, empowering as well.
It was an empowering process?
Yes, it was.
Yeah, great. And Imran?
I think the biggest takeaway is that we actually need to listen to our staff about how they're feeling. We don't know what's going on behind the scenes for them. So just having that safe space for them is really empowering as well.
Yeah, that's really...
I think the biggest take for me was that simple things, when brought to our attention, can be fixed, can be redesigned to make everyone's life so much easier. It might be something very simple, but it has a large impact.
Yeah, I think just adding reflections as well, we can see from the case studies that we've heard about so far, there's a huge range of investment that's involved in this, from just having a whiteboard present to investing in supernumerary shifts, and both have been successful, both have had impacts on employees and their experiences at work, but they're really tailored to the problem that was the really big problem at hand. Our last question is kind of a big question. If you had a magic wand for the day and you could identify one new work design change or kind of your next step that you would change in your work design, what would you choose to change, Canada?
I'm going to stray from the question a little bit. I would take my magic wand and start with the course training. The courses are designed for a world that is perfect and everything's peachy and rose-coloured, but we don't live in that world. And I hope we get there one day, but I think we need to change the way we start the training.
So having a more fit-for-purpose training, sounds like.
Yeah, absolutely.
And Sala?
I would say change. We need to be more adaptable to change, and people's mindset needs to change. We cannot stand at the same place with the changing times and everything.
Good one. Word up?
I'd be like extra staff, maybe. Sala?
I think for social workers, and my bosses are here, so reducing caseloads a little bit will help, but I think just from the onset, moving out from the induction and the onboarding, just checking in, providing safe spaces and regular supervision.
That sounds great. Did you guys have anything any last comments to add before we wrap up our panel?
I don't know about these guys, but I did find that through this research and project that we have amped up our communication between management and staff on the floor. It's been really vital, and it's easier for us to voice our concerns and for management to tell us their side of things and why we can't do certain things, or maybe we could do this instead.
It sounds like a huge one, to be able to have good two-way communication between employees and managers. Well, that wraps up our panel. Please, everyone, give our panel a round of applause and to say thank you. Now we've got Q&A. I'm hoping that we got some questions throughout, which we will have a look at now. But if you have any other questions that have kind of popped up throughout the event so far, scan the QR code and, we've got heaps. They all come through all at once.
All right. Let's do this.
This end one?
Yeah, well, there's a lot, so we'll just
Yeah,
go
this
for
is a good one. How do you prioritise the solutions you choose and as the best solution for the most important issue? So maybe we could hear.
I'll start
yeah,
this
perfect.
one. I think for our team, I was part of the Design for Care meeting with the team, and it was the staff that actually chose self-care and in improving their well-being. So that was the first place that we started, and that flowed on, and that's where we set up the weekly team meetings, the weekly leadership meetings, where we discuss strategy, what we're implementing for the staff, and how we can continue supporting the staff.
Did anybody else go through a different kind of process or experience?
I think for us, next to wellbeing of staff and clients, one of the biggest issues we face in our industry is staff shortages. It's not ideal, but it is the industry that we are in currently. So really taking the time to prioritise our staff and their wellbeing to make sure that we give our clients the best that we can. That was probably our biggest... That was how we decided that was our biggest issue that we were going to face first, I guess.
We sort of did it as to statistics were collected, and we really looked at what was the message that was coming more strongly, and which was handover time was, and then we listened to how we can fix it. So we sat together with the staff, and we went through, will this work, will that work, and we trialed it at first. And we'll say, well, it's not set in concrete, let's try this. And it was successful.
Mm. We have a question here about the whiteboard at Bankstown City Aged Care. What kind of information is on there? Who's responsible for keeping the information current? How often is it updated? Those kind of things.
Okay, so we came up with a few questions that we discussed with the RNs. What are the key information that we need to share with the care staff? So for any incidents that has happened on the shift, anyone that has gone on leave, appointments, or anyone that needs to go on social leave and things like that, or any other thing of concern that they want to hand over to the staff. So these were the main things, and the RN on duty updates it every day and keeps it, it's like a handover. So the RN is responsible for changing it on each floor.
Beautiful. How did you get leadership to commit to improving wellbeing, which is a big question?
I know for our team, wellbeing is always a priority. If we're not looking after ourselves, how are we going to look after the young people that we serve? So they supported the program and whatever we needed to do to support our staff.
It was pretty easy for us. Our management team was very on board from the first meeting we had where we discussed all the issues. I think they wanted to make improvements as much as we did.
We have another question here. One of our panel members, which I think was Canada, mentioned increasing and better communication between staff and managers. Have there been any other unintended consequences or benefits of that?
I think just benefits. I think we've worked on several different communication strategies and improving communication since we had this meeting. And we just need to find what works for us.
For the interventions that required a direct cost, how did we go about, I guess this is a little bit tricky for you guys to answer, but Anya might have an idea. How did you go about deciding on how it was funded? Were there extra provisions made for external parties?
I'm also looking around the room. Jackie or Khan, do you want to comment on that?
It wasn't particularly hard, I suppose. We see this as an investment. As Canada said, wellbeing, turnover, etc. So we really wanted to support this program as much as possible, and we crunched the numbers, of course, but it's an investment in the future of our staff, so we prioritised it.
Another one for Anya. How did we encourage or motivate staff to complete the survey? Which has been a big job.
Yes. Yeah, good question. Look, I think as a team, we were really, really keen to collect the best data we possibly could. Hello. So we were walking billboards. But I have to say, our partners have been fantastic. So often, many of the partners, including Nguyen and Bankstown and others, actually paid staff additional to complete the survey. So again, it's really important because it signals to staff that this is a valuable activity, that actually we really want to hear what you have to say and what your experiences of work design are like, how your mental health is going. And then if we do a good diagnosis, if we really understand what the issues are for staff, then we're in a better position when we get to those work redesign workshops to think about, well, what are key issues, open up the conversation and use it from a place of data. So there was a lot of effort. There were morning teas, there were road shows across regional and rural New South Wales, which some of us had never visited before. So there was a lot of time and focus on collecting the data, and we've had great response rates. And I know with our newest partner, our Wellways at the back there, they've only just started collecting data, and this is straight off the back of another survey that they had, and already we've seen really terrific uptake. And again, it's the commitment, I think, by the organisation and the communication. It's really important.
We have another question for Canada. You made a comment that the current training assumes that everything's just peachy when they're not. What kind of realities should the training incorporate?
I think the biggest one is just that they train for an industry that is overstaffed. They train for an industry where you'll have an extra 4 hours in your day to sit down and make a cup of teas and have a sandwich, and you just don't. There are just so many prioritising factors that we need to take into consideration. And I think that all starts with the training. They also have a fine way of depicting that you'll get to choose the certain parts of your job that you get to do, and you really don't. Once you're in it, you're in the deep end, and you really need to do all of it. It just makes things easier on the team, and you can ensure that your clients are getting everything that they need and that their needs are being met.
Helena's going to wrap us up with...
We're nearly at time.
Yeah, it's flying.
We have a few more questions, but I don't think we'll be able to have time to just... We want to be able to be respectful of your time.
We might just wrap up some key insights and learnings. This might actually answer some of the questions that's been asked. So what have we learnt so far? We've learnt a lot, but it boils down so far to 3 key learnings for us at the moment. The first is that we know that good solutions require good diagnosis. What we mean by that is that it really does, to do this right, you need to give yourself time to collect good baseline data and to really understand the current situation. Each organisation is different, and even within organisations, the different sites are different. The different teams are different. So you sort of can't make assumptions using broad brush. You have to be evidence-based and data-driven, and that does take time. And data comes in all forms, so it's not just through survey, it's just talking to people as well to start collecting a really good temperature check. Another really important reason why a good baseline is important is that you can then evaluate. You can then see what the impact is and whether any adjustment needs to be made. So it's an ongoing learning process. The second key learning for us is that and this came really clear in the panel, I would say, is that it's really important to involve the people in the change that's going to impact them. It sounds obvious, but that is a key foundational sort of value process in the PARRTH model of the co-design participatory process. In an industry that is characterised by constant change, we often hear from our care workers that change gets done to them. That's really disempowering. And so we need to be able to involve people and the voice, the safe spaces, to be able to come to these co-designed, tailored solutions that will work, because it's based on the concern of your staff. But it takes time, and it's not a checkbox compliance exercise. And finally, and this came through again, and I will just wrap up here and just to give you some other additional data that we haven't presented yet. It's really crucial to have leaders that are engaged and that are supporting. It doesn't mean leaders are doing the work, but they need to be engaged and they need to be able to support the change process. This graph here shows us the dotted purple line, that the impact of the intervention is much stronger when there's leader support. And if you look at the solid purple line that's going downwards, we could do harm if we have an intervention with low leader support. And you just got to see the 2 purple lines there. They're in completely contrasting opposite directions. That's a key learning for us as well. So that prep work and that buy-in and really getting our leaders to be part of the process, and leaders at all levels. So we might finish there, and we might ask you to give us a moment just to later when you have the opportunity to give us some feedback through the evaluation. That's on the blue paper. Anything else, Lucinda, just to wrap up the event?
We just want to say thank you all for attending and being engaged in your questions. And yes, thank you so much to our panel who have really generously given their time and their opinions and their thoughts to us, because they're really the reason that we're here and we're doing this work. So thank you again. And we also just want to highlight that our research is still ongoing. We are still collecting data, as we heard, and we're excited to continue to be able to share our findings throughout the rest of the year. So thank you all.
Thank you.